Welcome to the New Mom Talk podcast, your go-to podcast for evidence-based answers to your burning questions about parenting. Join us as we dive into commonly Googled topics and hear from experts and real moms. Let's navigate parenthood together, one question at a time. Hi, everyone. So today we're going to talk about something that we all get asked when we are about to have our baby, which is, do you want your cervix checked? So we're going to go over cervical exams, what that means, what that does. And for that, we have Bri Rice from Bri Rice Birth Support in Connecticut to help answer all of our questions. So, Bri, can you start off with telling us a little bit about yourself and your business?
I'm Bri. I am a birth doula, postpartum doula, childbirth educator. I work out of Connecticut, West Hartford. So my journey started as a nurse. I was a postpartum and labor and delivery nurse for 10 years. And after I was grateful for all of that experience, and then even more grateful for changing the path to full-time doula work. So I'm very happy to be doing this.
That's awesome. I feel like a lot of doulas kind of start off in that RN and then they tend to transition, which is really neat because you obviously have that background. And especially if you were in the, I don't know, maternity, baby nursing field. So, with that, let's go ahead and dive in. To start off, let's start with the basics. What's a cervical exam?
A cervical exam is when the doctor checks you. So when they feel your cervix and they use their two fingers to go in and feel for basically, there's 5 components. So they're checking for dilation, which is how open the cervix is or if it's closed. They're checking to see how thin it is. That's called effacement. They're checking station. So they're feeling where the baby's head is in relation to your pelvis. They're feeling to see if it's soft or firm, and like the actual position of the cervix. Is it really posterior? Those things don't matter as much as really where the baby is in the pelvis and how thin the cervix is, because the cervix needs to really thin out and ripen so that it can open and kind of break. The cervix is just an extension of the uterus. So eventually the cervix kind of dissolves up into the uterus. So we call that 10 centimeters. So you'd be fully dilated or complete. And that's when baby's born, when pushing starts.
When is a cervical exam typically done?
Typically, a lot of providers offer cervical exams in the office prenatally. And then typically when you come in labor, they'll want to do a cervical exam on admission and maybe they call it a labor check. So they'll check you once and then a couple hours later to see if you've made change. They usually want to admit you when you're more in active labor, so when the cervix is actually opening. They'll also check it throughout labor to check progress. Now, there are many other things that you can do to check progress, which is, how do you feel? You can feel your belly. Is your belly firm, soft? What's happening? Are you, restless, breathing heavy, having self-doubt? Do you feel a lot of pressure? Are these contractions coming stronger and closer together and lasting? A cervical exam, I think doctors love it. It's a number. It's kind of a way they can track things, but it's such a small part of what's really happening. And I think one of the key things to know is that it doesn't really tell you a whole lot. It can't predict when the baby will come, because you can be 3 centimeters for a couple weeks, or you can go from 1 to 10 very quickly. So, yeah.
So, as with pregnancy and birth, you don't know. Common theme in this podcast. Well, what should an expecting mama know about cervical exams?
So, I mean, kind of the same thing of, I think it can be discouraging. So when that is presented to you, it's not something you need to do. It's not wrong either way if you want to know your exam, if you don't. But frequent checks can be a little bit discouraging. So it's always your choice. So I think the big thing is if the provider comes in and says, and you kind of often hear this phrase of, "Oh, I'm going to check you now. Let's see what your exam is." And that's not proper consent. So just because somebody comes in and says this is what they're going to do, you can ask, well, what will this tell us? Like, or what if we wait a couple hours and check in a few hours, or and so you kind of sense the urgency of that, and most of the time it's not an urgent thing. I mean, one of the cons of having frequent vaginal exams is because bacteria can be introduced. So it's like we want to prevent infection and prevent too many.
I had no
I had
idea.
no
I had no
idea.
I had
idea.
no idea.
I had no
I
idea.
had no idea.
If you've ever said, I had no idea when it came to your parenting journey, followed by a smile, laugh, or cry, then listen up because this is for you. My name is Kelli, a stay-at-home mom of two wild, crazy, and fun little girls and host of Oh Baby, I Had No Idea, the podcast/YouTube channel. Each week, you'll get to hear my laid-back chats with other moms and dads from around the world as we explore some of our I had no idea parenting moments throughout our pregnancies, births, postpartum, and of course, the joyful chaos that is everyday lives with kids. You'll also get a wide variety of behind-the-scenes looks into some not so often talked about topics that need so much more awareness. If you're looking for something that's entertaining / semi-educational / might just make you feel a little less crazy in your own parenting journey, then this is it. Just type in "Oh Baby, I Had No Idea" in your favorite podcast platform or on YouTube to join us in the fun. See you there.
So you kind of mentioned, so the cervical exam can be done at one of your prenatal appointments and also when you go to wherever it is that you're going to deliver. That being said, can you refuse a cervical exam? So if somebody comes in and says, "Hey, do you want me to check your cervix?" But you're not in the hospital, you're just doing your, I don't know, 38-week checkup, 39, whatever it is. Can you refuse that?
Oh, absolutely. There's just hardly ever a real good reason to do it. Yeah, and unless you want to know, unless that information is going to help you.
Feel better.
Yeah. Yeah.
Whatever that means, right? When you're about to have a baby. So
But you can also refuse vaginal exams or cervical exams in labor. So if you come in labor and you're feeling pushy and you're like, I know my baby is coming. I don't need that tool. Like it's obvious how I'm feeling and how I'm presenting right now. So of course you can have a baby without ever having an exam. It's just not very common.
yeah, I mean, because they can definitely be very, very invasive, right? It's just you're put in a very vulnerable position. You're already very vulnerable because you are struggling just to move, to breathe, to get comfortable. And now you have, gosh, I guess you have somebody's hand up inside of you, and it doesn't feel good.
Right. It doesn't. Yeah. Some are more uncomfortable than others, especially if you're in labor, maybe you're tense, and so it can be invasive.
Well, do you have any other tips, suggestions, or recommendations for anyone that's expecting or is potentially planning and is going to be presented with a cervical exam?
I think one thing, if you don't want to be in the bed, you can be checked in any other position. So if you are consenting to a vaginal exam, but you're very comfortable kneeling or standing by the bed, or you're on all fours, the doctor can, or the nurse can check you however you are. And then other tips, I mean, just talking about the progress of labor, and the goal is to have the baby, and sometimes the tool of checking isn't really going to get you there any faster. What really gets you there is movement and letting go and having emotional support and having a good birth team, hiring a doula, having a partner who supports you. Those are the things that really matter and make a difference.
Yeah. Well, thank you so much. I'll have all of your information linked in the show notes for anyone that is interested in reaching out to you, can follow you from there. Thank you so much for taking time to connect and talk to us about cervical exams.
Yeah, no, thank you for having me.
Thank you for listening. Tune in next week for our next episode. You can find us on Instagram for more updates and tips. Be sure to subscribe wherever you listen to your podcasts and give us a review if you like us.